here. Going to give them an opportunity to introduce themselves. Maybe to begin with our far left. My sister, you may tell us your name and your area of expertise, if you don't mind, please.
Thank you. Good evening, viewers. My name is Anne Kiongera. I am a holistic counseling psychologist and addiction professional. Welcome.
Thank you very much. Close to her, your name, please, and where you specialize in.
Okay, good evening, viewers. I am Phyllis Chege. I am a registered clinical officer, and I'm delighted to be here.
All right. Thank you very much. The only gent in the house, please tell us your good name and your area of specialization.
Good evening, viewers.
Good evening.
My name is Gitao Ngogi. I am a medical doctor who is a surgeon specialized in hepatobiliary, which means liver and the intestine.
Good.
I'm also a church elder at PCA Nairobi West Parish.
Thank you very much, sir. Karibu sana. Reverend, it's your time now because you are host here tonight as well.
Good evening, viewers. I'm Dorcas Kamau, the parish minister Nairobi West, and I do a bit of counseling.
Oh, you are a counselor as well. I never knew that. Good to know. Now, I want us to have this talk tonight, and remember that you can also be part of this show by SMSing, as our SMS number is 0311220044, and of course our social media handles, CACTV Kenya on Facebook, CACTV_Kenya on Twitter. We'll be able to look at what you say about this whole issue at the tail end of this show. My name, of course, is Vincent Kerosi, and welcome you aboard, even as we take the next 45 minutes or so to look at this major issue that really needs a national debate, for that matter, alcoholism. But I want to begin by having just a background of information of what alcoholism is really about, especially worldwide. What the World Health Organization says, what the of course the NCD Alliance says, and other quarters. And this is what the World Health Organization says. 3 million people die around the world every year for alcohol use. That is one person per every 10 seconds. And more than half of these deaths, that is around 1.7 million people, are as a result of a non-communicable disease, NCD. And they say these all related to alcohol use. I also break down a few figures here from NACADA. This is NACADA's national survey on the status of drug and substance use in Kenya 2022. They say that 1 in every 8 Kenyans aged between age 15 to 65, an equivalent of 3.19 million people or Kenyans were currently at that year 2022 using alcohol. 1 in every 20 youth aged between the age 15 to 24 are engaged in alcohol use. 1 in every 7 youth aged 25 to 35 are addicted to alcohol. So this is actually a menace. Or what do you think? To begin with you, Reb, what do you think when we talk about alcoholism in the society?
Yes, alcoholism is a real menace in the society. Many people are involved, cutting across all ages, the young, the middle-aged, the elderly, both males and females, they are affected. And I think this is the right time that we need to think about it very seriously as a church and as a society and the whole world at large.
Dr. You specialize in liver, a very vital organ in a human body, and we know if there is an organ that is easily affected by alcohol consumption, excessive for that matter, is the liver. And we've seen that 3 million people die, and 1.7 million of these die as a result of non-communicable disease. And we know cancer of the liver is a non-communicable disease. How serious is this from your area of expertise.
Thank you. As you have just given us quite a bit of basic statistical analysis, alcohol is a beverage that is used in society, but has been known to be one that is used to very toxic levels. And those toxic levels are the ones that really damage our body. And so when we bring in the question of alcoholism, it is truly a menace in our society. And so this is the right time or the right moment to have a look, see how we can change the world in our own small ways and reduce that impact, if not to eliminate it, and have people live healthily. It is a chemical that is metabolized in the body, and the liver is a seat of metabolism for the ethanol that is consumed in the, there are so many other chemicals in it, but the basic one is the ethanol that is consumed to make one feel good. And so since it is a leisure beverage, the expectation is to have the feel. And the feel is that amount which has been taken by the body and has gone to the bloodstream beyond the liver. Usually everything that goes through from what we take from through our mouth goes to the intestines. And the first stop is the liver. So anything that is helpful will be taken away by the liver to the respective places. And a certain amount of ethanol is needed or is appropriate for production of energy. And when that happens, you find that is enough to be utilized like any other energy source. But the doses are very low. That would be minimum and acceptable. Most of it that is taken is usually above the required minimum. And therefore, you'll find most of it will pass beyond the liver, find its way to the circulation, and land in the blood, in the brain. And the moment it affects the nervous system, then we start talking about the effect of alcohol on our bodies. Ideally, it should not. And that's why it is taken as part of dessert during meals in people who are not taking it in toxic dosages. Yes.
Thank you. That is really expound in terms of us understanding exactly what the effect of alcohol is to the liver. And thank you very much, Dr. Phyllis, in your area of practice as a clinical officer, you I believe, in your day-to-day program engage or face such cases of alcoholism. How dire are they?
There are actually very serious consequences of alcohol. One, most patients tend to come with what we call alcohol withdrawal syndrome. And you find there are very serious cases whereby these patients, most of them are normally unconscious. And you find, as Dr. has expounded, it affects the CNS. And you find when the central nervous system is affected, at some point, an alcohol, when you take it in the normal doses, it becomes a stimulant. But when you overdo it, it becomes a depressant. So you find this, when it becomes depressing, you find it causes a lot of clinical signs and symptoms to the patient, which can become serious. And then you find there's the aspect of the family rushing in, the emotional turmoil, the psychological part of it. It's just, it doesn't only reflect on the physical aspect, but the holistic part of health, the emotional part, the psychological part, and the social part of it.
Yeah, sure. And the counseling psychologist, Anne, I want to believe these are cases that you encounter every single day. Maybe try to rehabilitate people back and try to bring sense into people that have been affected by this. How do you rate it from your own words?
I would say that alcoholism is a menace. It is a respecter of no caliber. Doesn't matter whether you are a clergy, you are a doctor, you are a farmer. It does not make a choice. Once you sink into alcoholism, it becomes a huge process, and changing or reversing the act is not easy. is a journey that takes lifetime. We always say that someone recovering from alcoholism is a lifetime process. It has no cure, but it can be managed. So what we are trying to tell people is we try to do what we are doing responsibly, because once we enter that docket of alcoholism, going back to the normal status of life is not easy. Yes.
Wow. Wow. What a background. Now I want us to get deeper into what we are talking about tonight. And it is about alcoholism and the family. How has alcoholism really become a determining factor in how our families either stand or fall, or whichever way we look at it? And I want us first to define for us, what do you understand by a perfect family for you? Rev, for you, we are to be asked, what is a perfect family for you?
Vincent, an ideal family is a family where all the systems run very well. There is mutual respect, there is love, there is communication, there is trust. Where all those things are not available, to their level best, then that family is not ideal. And when they are practiced in the positive way, everyone enjoys the flow of events, everyone enjoys the interactions, be it the children, be it the parents, be it the extended family members, everyone enjoys everything that is there. And therefore, for us to focus on the issues, and especially of alcoholism, we need to think of how to bring the ideal family to praise so that everything may flow very well at the family level. Because we find that when the parents or the children are alcoholics, the family doesn't function well. So ideally, an ideal family, it is where everything goes on well, as it was purposed, right from the beginning when God started the family.
There is a lot that the Bible says about the family, and will help us understand that and the roles that every person in a family has to take. But I want to understand, as a father, a doctor, and as a professional as well, what is the main pillar, or what are some of the pillars that you say really should prevail for us to have an ideal family?
Thank you, Vincent. Speaking from the perspective of a father in a family setting, I would look at the family as the basic structure which gives one hope that things are okay. One that where one knows that even if everything else fails, you have it. You have it available for you. So a perfect family is where the structure as intended by God, where we have the parents, the children, and also the other members of extended family. There is element of trust, mutual trust. And each and every member has responsibilities which he or she discharges without fail, because of being somebody who is dependable. These are the things that are taken away when our mental status or our mental functions are deranged. And that is why we are here today, discussing this thing that makes our mental status lose its position.
Yes.
And the family structure is threatened. Thank you.
I'll come back to you in a moment, but let me speak to Anne, because I've taken the church perspective, the father. I want now for you to allow me to use you as the mother figure here. And what for you, when you go back home and sit down and look at your family, and you really want your family to be a certain way you want it to be, what really do you look as the main things that will define your ideal family for you? And also as a counselor, I believe it's that
What I would say is that Anne, as a mother and as a wife figure in the house, she has her own dream of what is perfect. But as a counselor, I would say there's no family that is perfect. I would say that a family is a unit whereby you look at me and you look at my husband, people who have been brought up from different backgrounds, and they've been brought together because of the mutual agreement of love that has brought them together. Then they have given birth to children whom I want to raise this way. And I have a father figure who also has his own ideology of raising the children. It becomes a bit a complex unit. And that's why Reverend has said, we look at the respect, we look at the trust, we look at the profound characteristics of that family. But it's so hard for you to get it. The ideal family we look at with our naked eyes is not the actual family. It is a basic, it is a unit that is quite complicated. Mm-hmm. Yes.
Yeah, not easy. I want to use Phyllis as a child here, for that matter. Let's allow us to use you as, because you look like you are the youngling in all of us seated here, maybe me and you. As a child in a family, how would you love your family to be, for you to say, yeah, this is an ideal family?
Okay, for an ideal setup for a child, I'll feel like open and honest communication is one of the pillar I would love my unit, my family, my siblings to have, because you find a very effective communication, you're able to solve many things. The other thing will be love and respect. The moment there is respect and love among the family members, that we are able to share some moral values as a family. And another pillar that I would love my family, my unit to have, will be responsibility and support. Because I think responsibility is something which will be talked about more. Because we're able to see what mom is doing, what dad is doing. So we are able to see how everyone fits in their role. It becomes easy. The siblings are also, their labor is divisioned. So you find that helps a lot in support and what I'll call an ideal family setup.
I like that. And now looking at all these, would you say then, if you compare, the families that were then growing up, maybe you grew up in a family and you build yours, and you see maybe your children build theirs, would you say then that there is a compromise of what we knew then and what we know now, especially in the 21st century and the new era of doing things? Rev?
Thank you. I would say that there is a compromise in a way, since there is the issue of modernity, whereby things have changed, whereby in the former days, children had their own place, parents had their own place, but the modern world, you find that even the children can question their parents, can even call them to attention, and they can have a discussion. And therefore, some of the issues that we knew traditionally and culturally, they are not practiced today. So I would wholesomely say that there's a bit of compromise, and the way the family was known in the former years, it doesn't appear like it is happening now. There are some good things happening. The issue of communication and the issue of maybe even consulting, but there are some issues that have been compromised. The Bible, and especially in Ephesians, is talking about the roles of the children, the respect, the obedience, and also the response of the parents of not provoking their children. It is like all those things have been compromised, but there is hope. In God, there is hope. We can bring it back. Let us trust in God, and the family can come back as it was in those days where everyone knew his or her role.
Doctor, with globalization, modernization, and everything that is happening, do we say that the families have no option, no choice than other than to also, evolve and live as per the times, or a family should really remain on what is known for the standards that really make a family, or do you have to adapt?
Thank you, Vincent, for that taking us that direction. We have family structure that is known to exist in a certain way from since time immemorial. But what we are experiencing is human interaction. We are discussing about the 21st century. If you look at the yesterday centuries, many hundreds of years would pass with minimal change in terms of the way people live, the way they interact, and the way they do things. But in the past, we can talk of as short as even 60 to 80 years, there is so much change that we would talk of almost 1,000 years period without such kind of change in terms of the way we live. And therefore, the family has been affected markedly by that kind of paradigm shift. And one of the things is now the things that we used to call social norms and the basic structures of family. We are all aligned to the fact that we live once. So there is no one who has experience of having lived and wants now to come live better. We live it once and that's it. But we are shaped and we are affected and harmonized with the environment by things happening around us. So much as we would want to say, for example, look at my community that was there in the 19th century and how they socialized, how they brought up children, how the marriage was viewed, and even how they lived all the way to the old age, now things have changed. The communication and networking is so robust, such that I cannot hold a culture and say, this is mine. There is a lot of interaction. And this comes all the way from the time one is a child. By the time you are attaining adulthood, there is so much environmental impact on your behavior, such that your parents are alone, the impact they have on your behavior has been diminished over time. So having all those put into perspective, yes, we have no choice. We have to adapt to the environmental influence. But with that said and done, we have to hold certain values because God created us so that we can become his image in this world. And he gave us authority over it. And therefore, we have to align ourselves to his desire and his plan. And we know that this is a God who doesn't change. We claim that we have changed over the many years in terms of behavior, interaction, and equipment, and knowledge, and skills, and all that. But him, he remains the same. So
Yes.
I agree we need to do a bit of shaping up, a bit of adapting with the environment, but at the same time, maintaining our core values.
Our core values.
Yes.
Councillor, how easy is it to adapt to our environment that is changing every minute, but again remain us? How is that?
I would say that it is not easy. Why? When you look at the four of us here, we belong to different generations. So when we are looking at it, we have to look at the multi-generational growth or changes. That tells you, when you look at me, I was raised by very old parents. And their beliefs then changed me because I'm a product of upbringing and environment. So that tells you that if I want to bring the same character that was instilled in me by my parents to my children, it will be another world. Because for sure, I was raised in that old style generation, which was morally very upright. If I expect the same now with this generation that we are giving birth to, it will be very hard. We normally say change is a process. And as Dr. is talking about, is saying that we have to adopt. However, even if I'm not going to raise my children as I was raised, because if I bring those norms now, they might not work because of the exposure of our children nowadays through the social media, through the digital platforms. You can't compare them with ourselves. So what we need to do to cope with the current change of the 21st century is to accept to change for the better. We do away with the negatives and we come up and say, these are straight morals of nowadays. Then we cope with the present, because changing to go backward is next to impossible.
Yeah.
Yes, and it is going to give us a lot of mental crisis because of the pull and push. I want you to belong to the past, and you're already in the present. So the only way is to bring your children to God, let them understand the morals setting of what God wants us to do. But again, there was a time we even used to say that we can't give our children phones. But you even find you are buying one that you cannot operate yourself. To a point you have to look for that child who has no phone to come, and do some settings for you.
Yeah.
So we have to change positively, gradually, accepting the things we can change and those we cannot change.
Perfect, I love it. With all said and done, Phyllis, as young people, me and you, do you then feel the pressure to fit in to what we expected to do? Or what do we do then? Because we live in a totally new generation, brought up in a totally new environment, but we have to really fit into the standards and the structures that really make the family to be what it is. Do you feel the pressure?
Yes,
And do we sometimes give in?
There's definitely pressure, because you find what they have all said is actually true, because you find there's a shift and there's definitely a difference. This is because there are modern pressures which make change dynamic. In that, in this 21st century, you find they are shifting even in gender roles, like what the father used to do, now the mom and the dad are doing together. We have the work pressure, whereby now both parents are going to work, leaving the children at home, whereby there's no enough family interaction. So you find, yes, there's pressure, and sometimes we give in, whereby, like what Anne has said, in that they want now to instill, and some values, they are way past, but you find there are some values which we still need, our parents need to hold on to dear and pass them to us. So yes, there's definitely pressure.
There's pressure. Now, all this that we've talked about, imagine now, add on top alcoholism. How much of an effect is alcoholism having in our families? Because we know the pressures that now the family is facing with the 21st century. But now include that maybe a member or two in that family alcoholics, or they're struggling with alcohol. How difficult then does this make it to hold this family together, Dr.?
Thank you, Vincent. Yes, you have brought the point home. As we defined alcoholism from the time you gave the statistics and the effect it has, we acknowledge that it is a health condition. And alcoholism, which entails addiction and all the complications therein, is a disease which I don't want to call it non-communicable, but it could fall within that ambit. And so if it is a condition, then now we can look at it from a point of view of the threat it has to our normal and routine function.
Exactly.
If somebody is an alcoholic, then you find there are so many things that are deranged within their social norms. One of them is accomplishing tasks appropriately without failure, without fail. If we say that we wake up in the morning, we take breakfast together, or we are supposed to be in the house at this time of the evening, and we take dinner together, and we pray, and then we share the word of God and sleep. You find because of the effect of this health condition, I would even call it disease, since one of the members of the family or several members of the family are sick, they will not be able to sit and have communion and fellowship. And that will not be enough to break down one generation in connectivity with the other. And therefore, if, for example, is a key pillar, like the father in the family, who is going to be a victim of the illness of alcoholism, woe unto the family. Because chances of that family losing it from the beginnings are very high. And therefore, it is important for us to address it head on so that the family integrity can be maintained. The changes that are happening are okay. We can cope with it so long as we move together. But when one member of the family or two are sick, then the whole family is affected.
Sick as well.
Yes.
Kabisa. And now let me break this down a little bit about now the real issues here. Like, let's talk about GBV or SGBV for that matter, and help us understand how does alcohol really contribute to the monster, because now it's a monster in a society, gender or sexual gender and gender-based violence in a society. We get cases of, the victims affected every single day, and we wonder what is happening, where is the society headed to? But is alcohol a major contributing factor to this?
Yes, I would say yes, because once you become addicted to alcohol and you want to use it every day, we normally say it's a chronic relapsing disease. So it is a disease. So, and if it is a disease, where is it affecting? Apart from the liver, it affects the brain. So mentally, this person is not okay. And that is why you look at the SGBV happening every day. You find you are receiving children who have been abused sexually. You find you are receiving men who have been abused sexually. But if that man was sober, that could not happen. You find women who have been affected sexually. So I would say alcoholism is one of the effects that is leading to SGBV. Because many times even those children tells you, he came drunk. You know, the lady says, I drank, and by the time I wake up in the morning, this had happened. The man says, yes, I went to the pub, but I never landed home. I found myself elsewhere. So I would say these things are really not happening to the sober world. It is happening to the world that is really affected by alcoholism, which is a beverage that has many people who are using it as a drug of choice. Yes.
There is something you said earlier, especially in your intro, and you talked about responsibility and support. And you, as a daughter in a family, you really want your parents to be there for you, your brothers, your sisters, and to be present, to be responsible, and to support. But what happens when now there is neglect of roles? The father doesn't know what they need to do, the mother, the children. I mean, it's chaos all over, and possibly this is because there is an aspect of alcoholism in that family that has not been addressed. So let's look at this issue of neglect of roles due to alcoholism.
That is very correct, because you find when both parents, the mother and father, sink into alcoholism, there's that aspect of them prioritizing their drinking instead of their responsibility in the family. So you find what happens is that siblings, I will say I as the daughter, tend to stand up, step up to be able to do what they neglected, parental neglect, and that leads to emotional turmoil, emotional scars when people grow up. But yes, alcoholism contributes. It's a major contributing factor to parental neglect, whereby now children have to step up, do the parental responsibilities, and that leads to further emotional damage, mentally, psychologically, socially.
Yeah, Rev, you want to chip in and say something about this, even as you also help us understand how difficult is it now to bring about child in a family that is really struggling with alcoholism, even as you chip in to add one or two on what Phyllis has said.
Thank you, thank you. I would like to say that alcoholism in the family destroys every structure that is there. And especially on the issue that Phyllis has mentioned, the change of the roles, that if it is a father who is alcoholic, the mother steps in and plays the role of the head of the family, and also the wife. And also the children, they go to the same way. They take responsibilities that are not theirs. And so alcohol has destroyed so many families, because when one is alcoholic, it affects everyone. And we have also witnessed that when this person comes home, the whole family doesn't even remember what they need to do. Even meal times, even the work within the home, even working where one is employed, it affects everything. Therefore, this is something that we need to address seriously as a church and also as a community, because it is affecting the family, it is affecting production, even at places of work. So we need to think about it seriously as we go ahead. But I am saying it and I repeat it, there is hope. We have not, all is not lost.
All is not
There's still hope.
I love that aspect.
Yes.
Dr. We are now almost getting to the aspect of looking at how difficult is it to bring up a child in a family that possibly is struggling with alcoholism, because monkey see, monkey do, as they say. A child will grow to do what they see. You want to look at this and say, whatever we are seeing the young people go through, it's majorly not their own doing, but it could be because as parents we failed somewhere because we neglected our roles.
Thank you, Vincent, for bringing up the issue of the parenting or growing up in a family that is disgruntled by the effect of alcoholism. I would look at it from the point of view that we are social beings. The language I speak because I was taught by the ones who knew it before I learned how to integrate myself into society. So the language that my parents speak is a first language. And that's why, since the mother is the one who is closest to a baby, we call it mother tongue. So if the mother tongue of a child is alcoholism, then you can imagine the damage. And so if the family pillars are spoiled or are destroyed or are sick, because I still view it as sickness. Yes, because one thing about alcoholism is that no one would claim never to have come into contact with alcohol. Even here in church, we take it. as Holy Communion. But it doesn't make us alcoholics. The issue here is there are few people who become alcoholics. Even among 100 people, you find a very small proportion become alcoholics. And a good number would still maintain the intake within the beverage level, and they are able to sustain that. And that's why there is even discussion about genetic makeup and possibilities of having some deletions or alterations of genetics of individuals that could be inheritable. And that would mean exposed ones, you are easily addicted, whereas somebody else is exposed for a long time and is not addicted. That's a discussion for another day. But now when we come down to the family, it's unfortunate that the family of a person who is struggling with alcoholism will have children that would try to look for their space or to occupy their space in society, and they're having challenges. Challenges because the major occupant of the teacher is either not there or is teaching the wrong things. And so if that is the basis of upbringing in a family, then you can imagine the impact. And that's why we say when we come to the Lord, for example, and we give our lives to the doctrine of salvation, since one of the requirements is for one to stop the use or abuse of alcohol, you find there's some change. You find the family has changed. The father who used to look very untidy is now looking better. The mother who never used to take care of the children is having the children, going even for visits to school for their children. So you find a child who is having very good social support ends up being a front runner, a leader, a policy formulator, a person who influences society. A child who is brought up in a family that is struggling becomes a struggler, him or herself. And that is the problem, because this person will never have good self-esteem, will never actualize their potential because they were not empowered by the generation that brought them up. And these are the challenges we have to face.
Yeah.
Yes, so the family that is struggling with alcohol is definitely below par. Even if they pretend that they have actualized their desires, they could have done better.
Yeah, and you know, a below par family is a below par society,
Yes.
or community, and then a nation, yeah, at large, for that matter. Now, I want us to take, our last words in this and try to give what we think should be done, because Reva said there is hope. Hope is not lost as far as families are concerned. And maybe you help us and give us your final word. But I want to ask you a question, even as you give us your final word. We know it has been said excessive consumption of alcohol is harmful to one's health. But is there anything like safe consumption nowadays?
Okay, I would say there's no safe consumption, because we are all a product of genetical inheritance. You don't know which one you carry. You might end up realizing that you have the one that gets addicted easily. And when we look at the progression of addiction or of use of any substance, you find we start small. We start through experimental. Probably you went somewhere, you found your peers, you want to try. Then from there, we go to the occasional. You start using occasionally. I'm watching Manu, so I can't watch it in the house, so I go to the pub, and I have one for the road. Then from there, you become a regular user. A regular user is the guy who passed by the club near home or near the office every single day. Maybe have to for the road and go home. And then eventually you become an addicted person who cannot even go to work. You have to wake up in the morning and chase after the glass of alcohol, because you have already been addicted. So there's no safety. You start small, eventually you find yourself, you have become an alcoholic.
You're swimming at the deep end.
Yes, you're swimming in the deep end. And once you're there is when you start realizing, I have already sunk in. And you started small. So there's no safety in taking alcohol. Yes.
Then what do we have to do now? Because we have to salvage our African family. We really have to. What do you think we should do?
What I think we should do, number one, is take alcohol away from home. Because our children watch us take the alcohol. When we go away and we leave the leftovers, they also take. So what they're doing, we are modeling them to be who we are. And if I'm using alcohol, it has no problem. So I don't see any problem even for my child to test it. So what we are doing, we are introducing our children to alcohol so early. So I would say take alcohol away from the houses. That's the first point. Number two, I also want to say I thank my church, because as much as we use the wine here for Holy Communion, we also have an option of a non-alcoholic beverage. Why do we give that alternative? Is because if I've been an alcoholic, I've been using it, and I've already sunk into it, and I come here and I get that 1 pint for Holy Communion, I relapse. But if I have an alternative for the same, I'll come and take the alternative and I will be safe because I am not exposed to relapse. So I would say that as we are going on, we also avoid stigmatization. Okay. And because I don't want to be quoted here, we've been calling them alcoholics. I want all of us to withdraw that term.
All right.
They are people suffering from alcoholism.
All right.
We are not going to label them because we want them to come to Nairobi West. We want them to come and find us ready to support them to come out of the alcohol itself. And when even people come to church, do we judge them? So we have to be that Christian community that are very non-judgmental. Exactly. When they come, we embrace them. We walk a journey with them. Because even when we get born again today, I also need a process of delivery, of deliverance. Yeah. So if they come today and they are still relapsing and they're having lapses, we should not push them away.
Embrace them.
We should embrace them, continue to pray with them, and continue supporting them in this journey. And if you have a neighbor who is probably exposing the children, also visit them with love. Sometimes they think it's normal, which is not. Let us not watch the society sinking, because I might bring my children uprightly. They get friends from those families. What happens? Even all the work I did, it will get lost somewhere in the middle. Sure. So we would say we are one. Mm-hmm. Let us support everybody, especially we Christians. Yeah. Let us visit them. Let us talk to them until the time God will call them to come and join the church.
Thank you very much.
Yes.
That is really nice. Phyllis, what do we do then? Because we are in this, we have to find solutions. We have to help our 21st century family, or else we will be in for a very big shock in the next few years when we don't have a family at all.
So in conclusion, we have all agreed that alcohol is a challenge in the society, both in the upbringing of a child, in parental neglect, in the emotional part of it, the mental part of it. So like Anna said, the big issue is about stigmatization in church. So we should look on that, in that this is someone who is suffering and they want help. But if I'm coming to get help here and you're here judging me, that takes you a step back. So I feel that aspect is also supposed to be looked at. And education and awareness is something very important, because as a youth myself, you find it happens is that peer pressure in school. When you're done with classes, people just go drink. I feel like education and awareness is very important, because it just starts that that one drink and then it escalates and then you find yourself in the deep end and you don't know how to float. And then the last thing will be, as much as you talk to this person, the person has to allow help. That is where if you talk awareness, it's not working, we just push them to get a professional, a rehab center. So I feel like we should have that aspect of pushing them to get professional help if talk and counseling does not work. So there's that aspect of the church, maybe pairing with rehab, visiting them, seeing how their life is. That will actually go a long way.
Thank you very much. Dr. and Elder, what do you think we need to do?
Thank you, Vincent. As we conclude, I see it as a scenario where there is a lot that we can do. As our minister has put it, all is not lost. And the percentage of society which is adversely affected is significant, but not worrying though. We have hope. Therefore, we should look at it in two ways. I see it from the health perspective. One of them is the treatment corner. There are those who are already sick and they need support so that they can be cured from the disease. And the only cure is to make sure that we bring them to live a life which is devoid of alcohol. And the effects that come with it. There are some that suffer effects that are relatively irreversible. There are those that take long to have those effects reversed. There are those who require certain medication in order for them to be cured. So this is the rehabilitation process that I would say we have to enhance. You remember that mental health in our setting has not been an integral part of a long time. It's only now that we are integrating it into our basic health care. Previously, it was taken as a side training. Now, that is for the people who require rehabilitation. Now, let us come to the primary health care aspect, because the primary health care is prevention. Prevention, prevention, prevention. That one is possible. We have societies in this world who do not have alcoholism as a condition, and they live, and they are comfortable. And so, if they do, why not us? Okay, and the genetic mix that they have is equal to ours. There's no much difference. So therefore, it is a matter of how we are socialized. A while ago when I was a young boy, I could smell cigarettes almost everywhere in the village. And there was a lot of it. I would come to town and there is cigarette all over. Nowadays, I'm excited. I rarely feel the smell of cigarette in this city of Nairobi.
Maybe it's because you drive.
Not because I drive, because there are rules that were set.
Okay.
There are smoking zones. And that is the only place, if you have cigarette, you smoke from there. And that reduced tremendously the intake or smoking of cigarette in our country, significantly. If that could achieve a very good effect within a very short time, which is not even, it was during the Kibaki era, I remember, that means we are talking of 20-something years, if not less than 20. And if that is the case, then it means that if we took affirmative action in our society to address alcoholism, then it would be easy. We start from registration, we make it unavailable. We make it unavailable, and also we go back to the teaching basics so that the people who are coming up come up knowing that this is a health condition. We don't treat alcoholism as a disease. And that's why I have repeated it many times in this show, so that we can accept that it is truly a disease. If somebody tells you that there is something called cancer of the stomach, everybody would wake up and say so-and-so is sick. But when you have a neighbor who sells even chicken and sufrias in the house to go and take alcohol, to go and lie on the road there the whole day, we don't see it as illness. So if we are socialized in a way that would look at it as a medical condition, then things would change. And if we have changed with cigarette, which is so dangerous in our lives, and we have achieved quite a good amount of mileage, then alcoholism is not an issue.
So the question here is, why not? We can do it.
The issue is the people who are in the driving seat, they do not understand. They could speak from their pedestals and pretend to know, but unfortunately, you find they have very minimal understanding. Yes.
Well, Rev, as we conclude, you are the church, and the church is looked up upon to bring that societal change spiritually, and you have a role to play as a church. Maybe what does the church need to do that maybe it's not doing or doing better, so that this story or this discussion that we are having here can now be kind of celebratory. We celebrate the story, a success story, other than talking about the problem. And maybe you can also clarify, even as you finish, that kanisani kuna pombe. You need to clarify that. Yes.
Okay, thank you, Vincent. My friends here have said it, that we need to bring everyone on board, especially the church, creating awareness to each and every person, especially within the church. And then we are mission oriented. We need to do it as a mission, just as how we do mission, visiting even door to door, so that the awareness is created to even the smallest unit, that is a family. And so the church has a big role to play in creation of awareness and taking the message to the lowest level. Also, the other thing that we need to do, we also need to discuss it in our various groups, and especially our Presbyterian church is set in the groups. And when we discuss it in our various groups, because those groups, some of them are the youth, the women, the men, when we discuss it at that level, we create awareness and everyone will get the message. The other thing that we also need to remember is that alcohol destroys even the church. That one person, we need to not to point at him or her, but we need to just take care of him or her lovingly, and we direct them to the relevant authorities, and especially the rehabs and even the hospitals. And then when they go to the hospitals, they are shown how to take themselves, care of themselves medically. Then when they come to the church, we show them the love of Christ. But I'm saying, as I am saying, all is not lost. We just need to do what we are expected to do, and we'll be somewhere. It can take time, but even a journey of 1,000 miles starts with a step. So as the church, we need to up our game. And especially during this health week, we need to do it and do it very well. Just as we hold crusades, we talk about Christ, we also need to talk about alcoholism as a disease that everyone needs to be aware of, and everyone needs to come on board so that we can have a very upright society. Thank you.
Yeah. Kanisani kuna pombe?
Yes, kanisani kuna pombe, lakini ni kidogo. Ni divai ambayo tunakunywa kama tuna observe Holy Communion, ni kidogo sana. That one is minimal.
Kwa hivyo watu wasije wakasema kwamba kanisani kuna pombe, kwa hivyo hata mimi nitakunywa.
It is, hiyo ni divai, the altar wine, and it is normally very few meals that we take, negligible. Yes, it's just a sip. Just a sip.
Okay, I think you've understood that. But the most important thing is about the conversation that we are having, and this is all about alcoholism. And I want to really apologize if it was an offense, if any of the panelists used the word alcoholic. We apologize, we withdraw and say it's alcoholism. We apologize and withdraw that term. We've had this conversation, and I believe that you have a say, one or two. Please continue sending us what your view is, what your feedback is, what do you think should be done for us to save our families. Our SMS number, of course, is 0311 220044. our Facebook handles CAC Kenya on Facebook. That's Facebook, and of course our X handle is CAC_Kenya, and to be able to, of course, get to understand what you're saying and help us also. If you have a success story to do with maybe you suffered what you're talking about and now you are reformed and you think your story can help one or two people out there, please get in touch and to be able to also share your story and see how we turn around our society. Keep it CAC TV, because we'll continue with this broadcast of the Health Week, PCA Health Week 2024, as we major on the issue to do with alcoholism, because the theme is coming to senses and facing alcoholism. That's the theme for PCA Health Week 2024. Thank you for being a part of this show, and I also take this opportunity to thank every one of you, my panelists from my far left, Anne. Thank you very much. Thank you, Phyllis. Thank you, Dr. Thank you, Rev, for being a part of this show. And I believe that what you've said here is going to be of essence out there. I want to take the opportunity to say God bless you. Have a good night, and see you some other time as we continue with this broadcast of PCEA Health Week 2024. My name is Vincent Kerosi. I sign off. Ciao.